What are you allergic to?
Patient name is Kane Dobson, has been transferred from high dependency ward to trauma ward. Observation as between the flags. Patient complaining of pain 6 by 10 on deep inspiration. Doctor has prescribed morphine suspension to be given as well.
How long have you had this pain for?
Hello Mr. Dobson, how are you?
I'm good, thanks.
So doctor has ordered some morphine, which is a pain relief as you have pain. Are you ready for that?
Yep.
So before giving that, I want to confirm your identity. Is that okay with you?
Yep, sure.
Can I have your full name, please?
So it's Dobson Kane.
Okay. And your date of birth?
0 to 10.
Date of birth is 31/03/1994.
Okay. And your MRN is 050956742. Okay. Do you have any allergies, doctor?
Yes.
So you have allergic to?
Penicillin.
Okay. So what you get when you have allergies to penicillin?
So swelling on my face.
Okay, that's fine. We are not giving. Doctor, I just want to ask you, what is your pain at the moment? So 0 is the minimum and the 10 is the maximum, right?
So it's around 6.
Okay. And when you got pain, like when you are coughing or doing something else?
So when I deep inspired, then I got pain.
Okay, that's fine. And your pain is radiating anywhere, like towards the jaw or towards the neck?
No, I'm okay with that.
That's fine. Okay. I'm here only preparing your medication. If you need anything, raise your buzzer. Please give me a buzzer. Okay?
Yeah, sure. Thank you.
I'm also supposed to confirm with him which
Will you be my second RN for the validation of my drug?
Yeah.
So I have a patient named Kane Dobson, and the date of birth is 31/3/1994. MRN is 0956742, and the patient is allergic to penicillin. He got face swelling when he have penicillin. So anyways, we are not giving penicillin. So doctor has ordered morphine hydrochloride trihydrate. It's today's date, and the route is oral. Dose is 7.5 mg. It's 6 hourly, and the patient has a pain score of 6, and it has not been given. It is indicated for analgesia. Doctor has signed, print their name, and the contact details are there. It's not been given. Okay. So you okay with that?
Yeah.
So I'm going to check the names as well to see the dose and indication.
Alright. Now we have morphine, hydrochloride, trihydrate, also known as
So it's a morphine hydrochloride, which Odine is a brand name, and it is used for opioid analgesic, relief of severe pain, and the contraindication is opioid hypersensitivity, and for the biliary tract surgery, obstructed airway disease, alcoholism, and the precaution is for it causes the respiratory depression, and it can cause abrupt withdrawal substance abuse, ulcerative colitis. That's it. And adverse effects are GI upset, constipation, sweating, circulatory depression, and respiratory depression, which I have to tell the patient as well. And the dose is 5 mg orally every 4 hours, and usually it can be given as 5 to 20 mg every 4 hours. So we are giving 7.5 mg, so it's fine then.
Get the medication out. We have I'll let the medication down. I would like to just balance.
So I'll now go to the DD drug. Will you be my second RN to check the balance as well?
Yeah, sure.
Check that with me. Alright, so we have 100 ml or
So it's morphine hydrochloride.
Okay. And 100 ml has been last written, so that tells us that it is valid. Do you agree with that? Okay. I'm just gonna put this down, and then I'd like to lock my cabinet.
So I have a morphine hydrochloride, and the balance is 100 ml, which is approximately 100 ml, and I'm going to do my first drug check. I have a patient, Kane Dobson, and the date of birth is all correct. It's already been validated. Patient is allergic to penicillin. He got face swelling when he had penicillin, but we are not giving penicillin at the moment. So doctor has ordered morphine hydrochloride trihydrate. It's today's date. Route is oral, and the dose is 7.5 mg, and it is for 6 hourly, and the patient has a pain score of 6. It is not been given for the and it is for the analgesia. Doctor has signed, print their name, contact details are there, and it has not been given yet. So I have a morphine hydrochloride. It's 5 mg per ml. It's a 100 milliliter bottle. Expiry is 12/2023. So it's the same drug which we are going to give. Now I want to do my calculation.
At this stage, I'd like to do my calculation.
So required stock strength into volume. So the requirement is for the 7.5 mg, and the stock strength is 5 mg into 1. So it will be 1.5 ml which we are going to administer to the patient. Now I would like to do my second drug check. Will you be my second RN?
Sure.
The patient is Kane Dobson. Biodata is all correct. Date of birth is 31/3/1994. It's already been validated. And the patient is allergic to penicillin. He got face swelling when he had penicillin. Patient has been prescribed morphine hydrochloride trihydrate, today's date. Route is oral, dose is 7.5 mg, and it is for 6 hourly, not been given yet. For analgesia, it is for analgesia. Doctor has signed, print their name, contact details are there, it's not been given. Same drug, I have morphine hydrochloride, and it's 5 mg per ml. It's a 100 milliliter bottle, and expiry is 12/2023. So we can give this drug. And after calculating, my dose is 1.5 ml, which I am going to give to the patient. Yep. Now it's my second drug check. Now I'll do my third drug check. Before that, I'll prepare my medication.
Yep.
At this stage, I would like to discuss my medication. I like to wash my hands just before I do that. Just to make sure the technique of this procedure.
Stop. So it is 1.5 ml which I am going to give to the patient.
So we have 1.5. Then you'll be putting this down just to make sure we maintain a aseptic technique. Would you mind to do my second hour while I do my third drug check, please? Also, now we have the right patient, so we can confirm to be Dobson Kane. His date of birth is 31st of March 1994, and his MRI number has been confirmed against his armband to be 0956742. He confirms he's allergic to penicillin. It's been signed and dated by Dr. J. Smith. The right medication is morphine hydrochloride trihydrate. The right drug to give this medication is for oral. The dose is 7.5 milligram, which is the strength, and after our calculations, we happen to get 1.5. Here is my calculation. Do you agree with that? Awesome.
Will you be my second RN for the third drug check?
Yep, sure.
I have a patient, Kane Dobson. Biodata is all correct. Date of birth is 31/3/1994. I have already validated this patient drug chart. The patient is allergic to penicillin. He got face swelling when he had penicillin. Doctor has ordered morphine hydrochloride trihydrate in today's state. Route is oral. 7.5 mg is a dose, 6 hourly. It's not been given yet. And the indication is for analgesia. Doctor has signed, print their date. It's not been given yet. And here's a contact detail of a doctor. And I have a morphine hydrochloride, 5 mg per ml. And I have calculated the dose, which comes out to 1.5 ml. So this is my 1.5 ml dose, which I am going to give to my patient. The expiry is 12/2023, and the bottle is for 100 ml. So I have taken from that. Are you okay with that?
Yep.
So I'm just going to return the drug.
We have to keep amount received, but the amount given is 1.5 million.
So now I'm going to fill the DD chart now. So today's date is 29/3/19. Time is 11:50. Patient name is Kane Dobson. So amount given is 1.5 ml. So balance would be 98.5 ml. Name of the prescriber is John Smith. John Smith. And student nurse. Student nurse. Would you mind signing this as a witness? Yeah.
And can you tell me what kind of allergy you might find, please?
So now I would go to my patient.
Till then, thank you very much, Dr. Kane, and I'll be with you shortly.
Hello, Mr. Dobson. How are you?
Good, thanks.
I have prepared your medication. Are you ready for that?
Yeah.
So before giving that, I want to tell you that it's a pain relief, which is a morphine. It has some adverse effect, like it can cause respiratory depression. So before giving that, I have to check your vitals as well, and after 15 minutes as well, I have to check your vitals. So at the moment, I have your vitals, like your blood pressure, your pulse oximetry, respiratory rate, all are within the normal rate. And after giving the morphine, I will come back after 15 minutes to check your vitals. Are you okay with that?
Yeah, sure.
So before giving that, I want to confirm your identity. Can I have your full name, please?
So that's Dobson Kine.
And your date of birth?
That's 31/3/1904.
Okay, it's Kane Dobson, 31/3/1994, and your MRN is 050956742, 0956742. And do you have any allergies, Dobson?
Yeah, with penicillin.
What you have when you have penicillin?
So swelling on my face.
Okay, so we are not giving you penicillin, so it's okay. So I also want to check you, what is your pain score at the moment?
So it's 6 or 7.
Okay, that's
Yeah.
fine then. Anyways, I'm going to give you morphine.
Okay, can I?
And your position is alright?
Yeah, I'm okay.
It will take around 20 minutes to effect.
Thank you.
I'll come around that
Dobson,
time.
I'm here only. If you need anything, just give me a buzz. Anyways, I'll come after 15. So I'm going to do my documentation. So it's today's date, 29/3/19, and time is 11:55. And my sign. You want to sign as well?
I'll be looking after you today. And how are you? I'm good, thanks. Okay. I just read by your note and I thought I need to give you morphine.